Greetings, welcome back. So, after 135 years and millions of dollars invested, they still don't know what the cause of ALS is. They have no reliable diagnosis and no effective treatment. No, it's not medical. It's not medical science at fault because there are so many different ways that ALS begins. Some will lose their voice and ability to walk first. Some will lose their ability to type or play piano first. Um, some people have the use of both hands and both legs, but their diaphragm and their ability to swallow is first. So, with all these different onsets, it's difficult to be sure. So, the only really reliable diagnosis is to wait and see. And there's no effective treatment, but there are some medications that are given to ALS patients. And mostly what they do is buy time. The first is Riluzole, brand name Rilotech. It can delay the need for a trach tube if one chooses to do that. It can slow the progress of your disease by 2 to 3 months. Usually it is used in conjunction with Radicava, which is another drug that can delay progress. It requires several 1-hour IV injections. Riluzole is a pill. Radicava is several 1-hour IV injections. And for all of that inconvenience, the two together will possibly delay your symptoms 6 to 12 months. That would be something for younger people who have younger children or unrealized dreams. It would be worth it to buy time. I'm 63 years old, and so 6 to 12 months doesn't really mean much of anything to me. I'm fortunate that the progress of my disease has been very slow. Another thing that's on the horizon but needs lots and lots of study is telbivudine. It's already approved and prescribed for hepatitis B. It is a pill and seems to be able to reverse the effects of ALS in lower animals. But there are a lot of animal studies that they get a positive result in animal studies, but then they don't get a positive result in human studies because central nervous systems in lower animals are obviously different. The exciting thing that's on the horizon is something called NurOwn. It's still in trials. What they do is they draw off stem cells from the victim, process them, and then re-inject a person's own stem cells back into their muscle or their spine. And it seems to be able to arrest the symptoms and, in fact, improve. There are videos of a man who could hardly stand for 10 seconds on his own, running up and down a hallway after 3 injections. So it is, however, a little like dialysis because it would be necessary to have a new injection of these stem cells in the muscles or the spine every couple of months. So it can arrest the symptoms, but there's still really no cure. NurOwn may be as close as we have gotten to a cure. So this is where I am at the end of February 2019. Really not much change. I still cannot use my left hand. My right hand is fine. My legs get weak and tired very quickly and take a long time to recover, but that's been the case for a while. Like I said, I feel fortunate that if I have to have this disease, at least it's been slow progression. I have been dealing with this now for 2 years, and I have twitching, or they call fasciculations, in other parts of my body, but so far no muscle atrophy or loss of abilities in my limbs or speech or my ability to breathe or swallow. I know what's to come, but it's taking its time, which I guess is kind of nice. I'll see you again in late March, and hopefully the weather will be better.